Avian flu in Canada. What you need to know to stay safe. Avian flu has officially reached Canada, and with it comes concerns and questions about its impact on public health. Recently, a teenager in British Columbia became the first confirmed case of human infection with H5N1, also known as avian influenza. While cases of human transmission remain rare, experts warn that staying informed and cautious is essential. With avian flu cases rising worldwide, could the virus evolve to spread more easily between people? Let's explore what we know, what's being done to protect public health, and how you can stay safe. What is avian flu and how does it spread? Avian flu, or bird flu, is a viral infection that primarily affects birds but can, in rare cases, jump to humans. The H5N1 strain has caused significant outbreaks among poultry and wild birds across North America, often leading to the culling of millions of infected birds. Avian flu spreads among birds through direct contact, contaminated food, and environmental exposure. For humans, the main transmission risk comes from close contact with infected birds, their droppings, or contaminated surfaces. Human-to-human transmission is extremely rare *, and Health Canada emphasizes that there is no evidence of the virus spreading easily between people. Still, as the virus continues circulating widely among birds, experts caution that mutations could potentially increase its transmissibility. Why this first Canadian case matters? A closer look. Canada's first confirmed case of H5N1 in a human was reported in a British Columbia teenager. Public health officials believe the teen likely contracted the virus through direct or indirect exposure to an infected animal or an environmental source, though the specific source is still unknown. This case signals that while infection is rare, it remains possible for the virus to jump from birds to humans under the right conditions. Infectious disease experts note that the more the virus circulates, the higher the chance it has to adapt to new hosts, including humans. This case serves as a reminder of the need for ongoing vigilance, especially for people who work in environments with birds, like poultry farms. Monitoring these instances closely allows health authorities to understand how the virus is evolving and to prepare for any potential increases in human cases. Protective measures for the public. Avoiding risks and staying safe. Health officials emphasize that avoiding close contact with sick or dead birds is the best way to protect against avian flu. The virus spreads through inhalation of aerosols or droplets that may contain viral particles, which can enter the body through the nose, mouth, or eyes. If you come across a sick or deceased bird, experts advise calling local authorities or wildlife agencies rather than handling it yourself. For those who must handle sick or dead birds, such as agricultural workers or wildlife personnel, wearing masks, gloves, and eye protection is essential * to minimize risk. Washing hands thoroughly and avoiding touching the face while handling animals can also help prevent infection. The Canadian Food Inspection Agency urges residents to report any unusual or sudden bird deaths as part of the nationwide effort to monitor and control the spread of avian flu. Vaccines and preparedness. Canada's strategy for future outbreaks. While there is no need for mass vaccination against H5N1 at this time, Health Canada has outlined a strategy to ramp up vaccine production if avian flu shows signs of mutating into a more contagious form. Canada has agreements with vaccine manufacturers to accelerate production in case of a pandemic-level threat. The federal government also monitors flu cases closely and has authorized certain influenza vaccines that could potentially target H5N1 if necessary. Experts are currently not recommending stockpiling H5N1 specific vaccines due to their short shelf life, which limits their long-term effectiveness. Instead, they suggest focusing on early detection and rapid response * as the most practical approach to controlling potential outbreaks. Ongoing flu surveillance is crucial for identifying new cases early and containing any spread, which is why health agencies urge people to report flu-like symptoms promptly, especially if they've been in contact with birds. The bigger picture. Environmental and economic impacts of avian flu. The impact of avian flu goes beyond public health, reaching into environmental and economic realms. Each outbreak among poultry results in significant economic losses, as farms are often required to cull large numbers of birds to prevent further spread. This year alone, millions of birds have been culled in North America, impacting both the farming industry and the economy. Wild bird populations are also vulnerable, and cases have been observed in ducks, geese, and other migratory birds. As more cases appear in wild populations, experts worry about potential spillover effects into other ecosystems and animal populations. This ripple effect makes avian flu a challenge not only for human health, but also for biodiversity and agricultural stability, underscoring the need for comprehensive surveillance and response plans. What to do if you think you've been exposed to avian flu. If you've had close contact with a sick or dead bird, it's essential to monitor yourself for flu-like symptoms over the next 10 days. Early symptoms of avian flu in humans can include fever, cough, sore throat, and body aches. In case you notice these symptoms after exposure, contact your healthcare provider immediately and inform them of your recent exposure to ensure appropriate testing and care. The general public is not considered at high risk, but those in regular contact with birds should take extra precautions. Wearing masks, avoiding unnecessary contact with birds, and staying informed about the latest developments in avian flu cases are all effective ways to reduce personal risk. It's also important to remember that thoroughly cooking poultry and eggs destroys any potential virus, so there's no risk from eating properly prepared food. Staying informed and safe in the age of avian flu. Avian flu in Canada may be rare, but as this recent case reminds us, vigilance is key. By staying informed, avoiding unnecessary exposure to birds, and following public health advice, we can minimize the risk of infection. Canada's proactive stance on vaccine preparedness and early detection means that we're better positioned to respond to any potential changes in the virus's behavior. For more updates on avian flu, public health guidance, and ways to protect yourself and your community, subscribe, like, and share our channel. Join the conversation in the comments. Let us know your thoughts on avian flu, and any questions you have about staying safe. Remember, staying informed is our best defense against emerging health risks.